for Azad Jammu and Kashmir. He is head of pulmonology at AIMS Hospital and head of respiratory therapy at the University of Azad Jammu and Kashmir. The region's first FCPS pulmonology specialist. He led COVID-19 response, established units, trained staff, and advanced community preparedness. Please welcome Dr. Sohail. Thank you.
Good afternoon. I'm the last man standing between lunch and two, so I'll try and wrap up in 5 minutes. So, global perspective in Pakistan, I see some students, and when I see a student being a medical teacher, like some questions arise. So, if some of the students can reply, what is the bystander CPR in the developed world? Anyone can have a guess? I want this session to be interactive. I know you are a bit sleepy, but just.
Sorry.
Anyone? Any wise guess? 60 to 70% of the people they get bystander CPR in developed country. And what is the ratio of bystander CPR in Pakistan? 2%. What is the survival of bystander CPR in developed countries? Yeah. Almost you can say 40 to 50% survival for the developed countries. And what is the survival of Pakistan? 10% will be a great achievement. We are approaching 1%. So thanks to Initiative Next and the teams. How much of the cardiac MI patients they develop cardiac arrest? This is a rapid fire question, it's not a bio, but I just want to give you a perspective like where we're standing. About 8% of the MI patients they develop cardiac arrest. So how much time a patient of cardiac arrest has? Yeah. Every minute chances of survival decrease by 10%, and by the third minute brain starts getting anoxic brain injury which could be permanent. So we have the best teams, level 1, level 2, Sindh emergency healthcare system, they are improving our stats. And but average commute time for the Punjab team is like 9 to 10 minutes, and Sindh team is 15 minutes. So, do you think a cardiac arrest patient has 10 minutes? No, even if survives, he will be having anoxic brain injury. So, how many of the patients they travel by ambulance in Pakistan? I know after the realization of emergency services, the ratio is increasing. Yesterday I was hearing like about 24%. There was one study. But what do you think? What is scoop and run? Scoop and run is a phenomenon when there is emergency happens, and most of the times there are studies showing that 86% of the times the first family members they do not do CPR, but they do try to rub the palms, throw some water and put it like in a rickshaw or whatever, and patient travels to the hospital with no oxygen, no CPR. And what happens? That's why we stand at 1%. Patient seen dead. So that's the point like where we need to work. And the globally we stand like to see how much contrasting is the difference. And I forgot to mention I was the second shy speaker in this conference. First was Sir Mahmood yesterday, and I took some tips from him. Hopefully they work. So I'm going to start. I'll finish within 5 minutes. So my introduction is already there. So how this story happened? I'm a practicing physician, a pulmonologist, internist, and intensivist. When the COVID wave was like declining by December 28, 2021, I got a phone call from my sister that your brother-in-law is not well. I asked him to just let me talk to him what happened. He said I am having some gastric, when I took the omeprazole, I'm feeling better. But my sixth sense was telling that he was a smoker. I told me take an aspirin, go to the hospital, I'm coming there. And in 3 minutes time, she called me that he has collapsed. And I was trying to tell her, please start CPR. And she said, what is CPR? So that time I thought, I lost. I lost because he was a dear friend of mine, and that was a huge loss for me. And this journey did not begin in a conference room. At that time, I decided that 70% of the first responders to a cardiac arrest are household females. 70%. So we need to target them. And unfortunately, the nature has its own balancing act. We have highest maternal mortalities, but you see, the cardiac arrest happens to males. Medical students, why it happens in males more? Yeah, the estrogen is, nature is balancing, okay? So the females, they are the first responders, and the males, they are the recipients. After menopause, this ratio equals. So what happened? I took this, most of the, passions, they are a result of a deep trauma. If you see the different thing, this trauma, like initially, I took a few months to gather myself, but I decided I'll try something to make the CPR, and this is such a life-saving skill common. So what I did, because sudden cardiac arrest does not give you time. Even double one, double two, they cannot help you that much in revival. We have to have the lifesavers, the rescuers in every household, in every office, in every neighborhood. We need to have them. So help arrived late and we lost him. The key idea was that the people were present, preparedness was not. And you see, every hour we are losing 47 Pakistani citizens due to MI. 1100 deaths per day. So like what happens, we say, okay, this happened to like, some distant relatives of us, we are safe. That was my, it cannot happen to us. But now it is a story of every household, every second household. And because we are talking the charts of diabetes, metabolic syndrome, and MI is one of its manifestations. So what we did? So we turned loss into leadership. I met with my principal of medical college because I'm a faculty member. I met with the Prime Minister of Health. We drafted some protocol, whatever I knew. And they said, the principal was quite, he was encouraging. He said, okay, we'll try to see. The minister said, okay, doctor, that's fine, but like, where are the funds? How can we do that?
Sorry to interfere, notice we have 1 minute left.
Oh, sir. So what happened? Then I met the most inspiring person in my medical career. Principal told me that you should meet a person, Dr. Aisha Basi was there, and Dr. Junaid came to Muzaffarabad, and we met up. He said, Dr. Isa, my proposal, he said, you are, and we are working on the same line, so come aboard. Okay, sir. I said, sir, yes, Roger's boss. And that day, we started working on that. We arranged a meeting with prime ministers, and there was high-level meeting was done, and they promised that the logistics, because Kashmir has its challenges. So logistics, unfortunately, that was not fulfilled because the political instability, a lot of changes, transfers in bureaucracy. So, but reality note systems move slowly, but lions cannot wait. Every hour, 47 Pakistanis, we are losing that. So what happened? We opted for choose targeted departments because the MOUs, they take a lot of bureaucratic time. So what we identified with the medical college and health department, lady health workers, we had this inspiring speech by lady health workers. We started with them. Swain Bhai and the team, they came to us in 2022. That was the first step. And then we started collaboration with Double One, Double Two. We conducted in every division of Kashmir. And then another thing that happened, because when there's a fire and you start digging wall, it will take time. We are doing these trainings, that's a great thing, because if like 15% of the population is trained, then the mortality benefit will show. But another thing, I thought that because Kashmir is like 70% of the literacy, so we started collaborating with University of AJK, Education Department, elementary schools, and we incorporated this PLSP syllabus into them and the fourth semester of the university, and that syllabus is subject to assessment. So what happened, these are I'm thankful to the VCs and the people who are so much supportive. Right now, in 2 years' time, we have reached up to 10% of our population. So by the next year or two, we hope that we may reach up to 50% of the population, and the greater the reach to the population, the better the results. So that's my final message would be that when communities across countries learn, train, and act together, survival becomes a shared responsibility. Thank you.